Another step further on the data, or the being able to have a centralized location and giving patients and control of their own data. I mean, having in this case, a centralized location, or really you could say decentralized, each individual has control of their data. I feel as though for healthcare, that's very powerful. And there's a lot of things you can do with that. And I'm curious, can you highlight some of the use cases or applications you're building on top of that to be within your ecosystem? I feel like there's a lot, there's a lot of use cases you could go, but I'm just curious if you could highlight a handful of them, especially the ones that are you see the most engagement in.
If I go back to PowerPoint slides for a second, I'm just going to start with the basic obvious thing, right? Which just this makes healthcare better, right? This is a case study that was done in Southeast England. They had 4,000 patients with inflammatory bowel disease. IBD affects about 1 in every 150 people. Most of the time you're fine, and then you're really not fine. You flare up and you need urgent attention. And the longer periods of being fine, the longer you can keep your gut without having to have surgery. And the faster you can get treatment during a flare-up, again, the longer you can keep your gut and stay away from surgery. So these guys, they're registered all their patients. If you came to clinic, they say, this is your data. I need you to have your data. I'm going to give you a Patients Know Best account that'll give you your test results. As soon as I have them, you will have them. And I will give you instructions on what to do. So take these medications in the care plan at this time. Normally, if you get a flare-up, this is what you need to do. Without waiting to call me, this is what you need to do. And if these things happen, I want to hear from you immediately. And you can tell me immediately because you can consult with me online through PKB. And in the meantime, you can keep track of your symptoms also on PKB, so I can see how you're going week to week. So just using that, they save £4 million. That's about $4.5 million, $5 million US dollars on those 4,000 patients. And that was really from, they could change medications that were more cost effective, but they tend to be avoided because of the side effects profile. So if you can monitor the patients more frequently, you can identify which patients are okay and which patients need different medications. They avoided appointments, so that freed up capacity for the patients who needed attention and freed up time for the patients who didn't need to go for the appointments. And because the patients who needed help got help more quickly, they prevented progression to surgery. So this is one cohort, one disease in one region. You can see the cost savings you can do. And the patients love it. I mean, for me, one of the most moving stories was I saw one of the patients, a young man. He was a student, and this affects people at working age. He almost dropped out of university. He said the only thing that kept me in was having this system, because I didn't have any control over my health, over my life. I was going to go back home and just stay with my parents because things were so bad. But because I had the system, because I could see the data, because I could add to the data, and because whenever I got stuck, my physician was one message away, I stayed at university. He's now graduated. He's in the workplace. It's stories like that from just having the data and adding to the data. Now, when you're asking me, what can you do with a platform? I'll just a quick run through. So the kinds of things that we do. This is what happens when you combine data from different record systems like Cerner in a hospital, or in the UK, you have EMIS in physicians' offices. Silos of data all arrive in the one record wherever the patient's gone. This is what happens when you can collect data from the patient. So we have the most depth in patient engagement of any platform. You can track their symptoms, connect over 100 devices, give them their test results, and then do a shared care plan between you and the patient of what they want to do. And that was the reason that Renal Patient View switched to us. So this was a disease portal for all dialysis patients in the UK, across 74 hospitals in all the UK. A couple of months ago, they gave us a contract. They switched all their hospitals over to us because a generic system that can do anything was more powerful for kidney disease than a custom kidney system. And so we're now doing the same thing for Cancer Portal. We just got a contract in the UK for the Somerset Cancer Register, and so on. Basically, every disease area is better if you put the patients on the one system. Then you start combining data from regions. So we started in 2015 in Northwest London. That was 2.4 million people. London is almost 9 million people. And basically, people in London do not read the government's plans for how hospitals should be organized. They go wherever they want to. Every 12 months, 20% of them move house and change provider. So for them to have one system, no matter where the patient has gone, was very powerful for safety. Now, what they discovered when they switched this on is they found data from all over the UK, from Manchester, Birmingham, Bristol, parts of Wales. All that was available to patients in London because these patients go everywhere in the UK. And then the Welsh National Government, so that's 3.5 million people, did the integration with us. This is what we pursue in the long term, a contract with the national government to say, if a patient registers, give us all their data because we will empower them wherever they go. And then people did this at national level. This is the NHS app. England, which is 55 million people, has a national app. We're the first and the only ones to integrate inside it. This is what I'm so excited about in my video. So we now unveiled the app where it's branded by the NHS, it's branded by the national government, but the full functionality is all delivered by PKB. The test results, the care plans, the student tracking, and so on. And we're bringing this to other governments all over the world saying, look, you may have built your COVID app for test and trace, but now you want to build on that by giving a full personal health record with your brand, with your sovereign app, so we can white label our product inside their national infrastructure. And then all the different third parties in the ecosystem, the thousands of companies you talk about, can integrate with that in the two-way API, whether it's tracking information from the patients at home, allowing them to book an appointment. We have Current Health here. They're being used for COVID patients because they stream into the PKB record your oxygen saturations and your breathing rate. So if you have a COVID patient, you want to isolate them at home for their safety and the rest of the healthcare economy's safety, but you want to track them real time, and that comes into PKB with the API. And then people build solutions on top. So in the Netherlands, Radboud built a platform for blood cancer patients. There are 2,000 patients in the Netherlands with chronic myeloid leukemia. One of the 2,000 are already on the system, and they're rolling this out across the Netherlands as the national standard, and then they'll expand it to all blood cancers. That's 60,000 patients across the Netherlands and so on. So all of that is possible when you have a data platform with patient engagement, a single record that's complete, accurate, in real time, following the patient wherever they go.